Hi everyone, thanks for watching today's video. Today I'm going to talk about benign tumors of the pancreas. Now if you don't know what pancreas is, please watch my link on the video below. And if you don't understand what a benign tumor means, and in my previous video I discussed about the difference between benign tumors and malignant or cancerous tumors. So please look at the link below again. Another problem with the pancreatic benign tumors are some of them are not completely benign, that they start off as benign tumors when they are very, very small. But if left alone and they start keep growing, then they can change into cancer later on. So they are called precancerous tumors, which mean they have a potential of changing from benign into cancerous tumors. So just going to quickly recap the anatomy of the pancreas. So I've drawn the pancreas there in green. In the middle of the pancreas, this green tube is the pancreatic duct. You can see there are lots of green areas in the pancreas, which is what we call the exocrine part of the pancreas. And this comprises about 95% of the whole bulk of the pancreas. So you can see there are lots of green in there. However, there are small little areas of red, little islands of red over there, which I've drawn. This is the endocrine part of the pancreas. And this comprises only 4-5% of the whole bulk of the pancreas because they're very small areas. What is the difference between the two? So the green areas that I've drawn, the cells, they secrete enzymes which will go into our pancreatic duct, which is the tube in the middle of the pancreas, and from there go into our small intestine, where they will help digest our food like proteins, fats, etc. And when we eat food, food will come in here, the juices will go out and help digest our food. The little islands of cells over there, which are called islet of Langerhans, they secrete hormones. So hormones are like same thing as enzymes. However, instead of going into the intestine, they go into our bloodstream. And there are two main hormones. One is called insulin, which decreases our blood sugar, and one is called glucagon, which does totally opposite, which increases our blood sugar. So the vast bulk of the pancreas is made up of exocrine part of the pancreas, which is the green bit I've drawn over there. So 95% of the tumors that arise from the pancreas arise from this part of the pancreas because there are far more cells as compared to the endocrine part of the pancreas, which are only small little bits, which comprise only 5% of the tumors of the pancreas. So now let's discuss different types of benign pancreatic tumors. So there are two main varieties of benign tumors in the pancreas. One are called serous cystic and one is called mucinous cystic. What does cystic mean? Cystic means like a sac. So they look like a little balloon or a little sac inside the pancreas, either sticking out of the pancreas or inside the pancreas. If they're full of fluid, which is very watery, then they are called serous. Serous means watery fluid. These tumors are almost always benign tumors, and they do not have a very small potential of turning into cancerous tumors. So they are considered purely benign tumors of the pancreas. If, however, these little cystic lumps contain something look like jelly, which is mucinous cystic, then although they might start off as benign, but they have a potential being precancerous, they can change into cancer over a period of time. So it's very important for what doctors do, keep an eye on them to make sure they're not changing into anything a bit more serious. So those are the two main varieties of benign tumors of the pancreas. So I've written the name of two for the tumors over here, which arise from these little cells in the pancreas. One is called insulinoma. Insulinoma, as the name suggests, produces too much insulin. And the problem with too much insulin in our body, as I explained earlier, that blood sugar will go down. And these patients, their blood sugar stays so low that they keep fainting, sweating, and all the symptoms of very, very low blood sugar. Very uncommon tumors. The second variety is a gastrinoma, which secrete a substance called gastrin. Gastrin is a substance or an enzyme in our body which is normally produced in small amounts from the stomach when we eat, and gastrin stimulates our stomach to produce acid, and acid in turn helps digest our food. If our body starts producing too much gastrin, like from a tumor in the pancreas or elsewhere in the body, then too much acid is produced by the stomach. And because of that acid, unusual ulcers take place. Like there are excessive ulcers in the stomach, in the small intestine. Patients can get severe bleeding, perforation, and gets all sorts of problems from this excess acid like diarrhea, etc. Again, a very uncommon tumor, usually benign, but certainly can change into cancer. So how are these tumors diagnosed? So patients might have no symptoms at all, or might have some symptom like abdominal pain, back pain, blood sugar going up or down, or producing ulcers, etc. So they might have symptoms, but very small tumors don't usually cause any symptoms to the patients at all, especially if they're not producing any enzymes or any hormones. So the patient might have a CT scan done for something else, like for looking at the liver or the gallbladder or something else, or for weight loss. And the CT scan might show a little lump in the pancreas, like a cystic lump or lump like this, or some other sort of a tumor. And an MRI can be done to confirm the tumor is present, what sort of a tumor it is, what sort of fluid does it contain. Does it contain clear, watery fluid, or does it contain jelly-like substance? One of the most diagnostic ways of looking at pancreatic tumors is an endoscopic ultrasound. So it's an ultrasound which is performed with a camera, and the camera is put down through the mouth into the small intestine, and it has got a scanner inside the endoscope or the camera, and that can pick up the tumor much easier. And through this endoscope also doctors can take biopsies of these tumors to confirm whether there is benign or malignant. However, in many occasions, doctors still can't be sure whether this is a benign tumor or a cancerous tumor. So what makes them suspect? Because there's a possibility this could be a cancerous tumor. The first thing would be size of the tumor. So if the tumor is over 3 centimeters in size, which is about 1.5 inches in size, then there is a high possibility this might be a cancerous tumor. If there are areas in the tumor which are part solid and part like full of fluid, like cystic, then there is a high possibility that this tumor might be a cancerous tumor, or maybe a benign tumor which is changing into a cancerous tumor. Still uncertain, then what doctors do sometimes, they repeat the scan after a few weeks or a few months and to see any increase in size of the tumor. So if on the first scan the tumor was 1 centimeter in size, and in a month's time or 2 months' time when the patient is rescanned and the size of the tumor increases from 1 to 2 centimeters, then obviously it is growing too fast and is possibility that it is not a benign tumor but a cancerous tumor. So to recap, tumors of the pancreas can be benign or malignant. Benign tumors of the pancreas are far less common as compared to the malignant tumors of the pancreas. Sometimes they can produce hormones like insulin or glucagon or gastrin, which can give rise to quite serious side effects even if they are benign. Many tumors of the pancreas might start off as benign, but however, with time can change into cancerous tumors. The way of diagnosing these tumors is by CT scan, MRI scan, and endoscopic ultrasound. Not all of them require treatment if they are totally benign. They only require treatment if they're causing severe symptoms to the patient, or if they're changing from benign to cancerous tumors. I hope you found this video informative, and if you did, then please remember to subscribe and support our educational channel, and give us a thumbs up and click the bell icon. Thank you again for watching.